All right, so today we're gonna dive into how AI is changing the health industry.
Okay.
We've got a really cool report here from PwC that outlines some of the key ways that AI is already at work, and we've also got an expert here with us to give us some real-world context.
Sounds good.
So, are you ready to explore this with me?
Absolutely, I am.
Awesome.
It's a really exciting time to be in healthcare right now with all these advancements. It's not just about robots in the operating room anymore.
Right.
Although that's certainly part of it. What we're seeing is a fundamental shift in how healthcare operates. And AI is touching everything from early diagnosis to even creating new drugs.
Yeah, the PwC report actually highlights 8 different areas where this transformation is happening, and some of them are pretty mind-blowing. One that stood out to me was how AI is being used to help people stay healthy, rather than just treating them when they get sick.
Yeah, that's a really crucial point. The traditional sick care model is slowly giving way to a more preventative approach. And AI is playing a big role in that shift. So you can imagine like an app that analyzes your daily habits, your genetic predispositions, even environmental factors. To provide personalized recommendations on how to stay well, it's like having a super-powered health coach in your pocket.
Okay, that's seriously cool.
Yeah.
But AI isn't just about prevention, right? It's also making waves when it comes to early detection. The report mentions AI reading mammograms 30 times faster than humans,
Correct.
and with 99% accuracy. So that's a potential game changer.
Absolutely. Early detection is crucial for so many conditions. And AI is giving us a tool to identify those warning signs earlier than ever before, potentially saving countless lives.
And then there's the impact on end-of-life care. The report talks about robots emerging as companions and helpers for aging populations. This is one that always makes me think of those sci-fi movies. But it's actually becoming a reality. What are your thoughts on this? Is it a good thing, or are there potential downsides?
It's a complex issue with no easy answers. On one hand, these robots can provide much-needed companionship and support for seniors who might otherwise feel isolated, helping them maintain a sense of independence and dignity. But on the other hand, we need to be mindful of the ethical implications. Can a robot truly replace the human touch and connection that's so vital, especially in those later years? It's a question we need to grapple with as this technology evolves.
It definitely raises a lot of questions, and I appreciate you bringing that nuanced perspective to it. Now, the report also highlights some of the big players in this AI healthcare revolution, specifically mentioning IBM's Watson and Google's DeepMind. These aren't just tech giants anymore. They're actively shaping the future of medicine. Can you tell us a bit more about what makes these systems unique and what they're being used for in practice?
Sure. So both IBM Watson and Google DeepMind are powerful AI systems, but they approach healthcare from slightly different angles. So IBM Watson is renowned for its ability to process and analyze colossal amounts of data, including medical research, patient records, and even clinical trial results, and it's being used to assist doctors in diagnosing complex cases, creating personalized treatment plans, and even identifying potential new drugs. Google DeepMind, on the other hand, is deeply involved in applying machine learning and neural networks to medical challenges. They're making strides in predicting acute kidney injuries, detecting eye diseases, and even optimizing cancer treatments.
So they're both using AI, but with different approaches and applications. It's fascinating to see how these tech giants are leaving their mark on healthcare. Now let's shift gears a bit and talk about something that really caught my attention in one of the other sources we have. The potential for AI to completely revolutionize the way new drugs are discovered. Did you know it currently takes an average of 12 years and a staggering $359 million to bring a new drug to market?
Wow.
It's a long and incredibly expensive process.
It is. And that's one of the reasons why AI is such a game changer in this field. The PwC report dives into how AI can analyze massive data sets of molecular structures and clinical trial data to identify promising drug candidates much faster and more efficiently. This has the potential to significantly reduce both the time and cost involved in drug development, which could have a huge impact on patients.
Imagine getting life-saving treatments to the people who need them in a fraction of the time. It's pretty incredible to think about the possibilities. But we also have to consider the human side of all this. The report mentions AI-powered training simulations for doctors that are becoming amazingly realistic thanks to natural language processing. It's like something straight out of a futuristic medical drama. What are the benefits and potential drawbacks of this kind of training? Can AI really replicate the nuances of human interaction in medicine?
Well, it's an exciting area with lots of potential, but also some limitations. These AI-powered simulations create a safe and controlled environment for doctors to hone their skills and decision-making abilities. they can be exposed to a wide range of scenarios and patient responses without any real-world consequences, which is invaluable for learning. And as natural language processing advances, these simulations are becoming incredibly lifelike, allowing doctors to practice communication skills and empathy alongside their clinical knowledge.
So it's a powerful tool, but not a complete replacement for a real-world experience. It's more about augmenting the human side of medicine rather than replacing it entirely, right?
Exactly. It's about finding the right balance and understanding the strengths and limitations of both AI and human intelligence. They each have their own unique contributions to make in the field of healthcare.
And what about the overall impact on healthcare accessibility and affordability? One of our sources highlighted the potential for AI to democratize healthcare, making quality care available to more people, regardless of their location or socioeconomic status. Can you break that down for us a bit? How would that actually work in practice?
Well, one of the most promising aspects of AI is its potential to bridge the gap in healthcare access. For instance, imagine AI-powered diagnostic tools being used in remote areas where specialists are scarce. This would allow patients to receive diagnoses and treatment recommendations without having to travel long distances. And as we discussed earlier, AI can streamline processes and automate tasks, potentially making healthcare more efficient and affordable for everyone.
So it's not just about fancy robots and futuristic treatments. It's about making healthcare more equitable and accessible, which is a really powerful concept.
It is, and it highlights the importance of having these conversations about the role of AI in healthcare. We need to be mindful of both the potential benefits and the challenges, so we can harness this technology responsibly and ensure it serves the greater good.
Absolutely. And speaking of challenges, there's another crucial aspect we need to address.
Yeah, absolutely. And that's data security and privacy.
Right? Like, how do we make sure that all this information that's being used by AI is kept safe?
Exactly. As AI relies more and more on data to function, the question of data security and privacy becomes absolutely paramount.
Okay, so what can we do about that?
Well, we need to be thinking about things like robust security measures and clear ethical guidelines to protect patient information. This is particularly crucial given the rise of cyber attacks and data breaches we're seeing across all industries.
Yeah, it's kind of scary to think about all that sensitive information being vulnerable. So how do we balance the need for data sharing, which is essential for AI to work effectively, with the need for data privacy?
Well, it is a delicate balance. Transparency is key. Patients need to understand how their data is being used and have a say in how it's shared. There are also exciting developments in areas like de-identification, which removes identifying information from data sets, and federated learning, where data can be analyzed without being centralized in one location. These approaches offer potential solutions to protect privacy while still allowing AI to do its work.
So it's like we're trying to find ways to use the data without actually exposing the individual's identity.
Exactly. That's the goal.
That's pretty cool.
Yeah.
So what are some other challenges we should be thinking about as AI becomes more integrated into healthcare?
Well, another big one is the regulatory landscape. AI is evolving rapidly, and the regulations need to keep pace to ensure these technologies are being used safely, effectively, and ethically. This will require collaboration between government agencies, healthcare organizations, and technology developers to establish clear standards and guidelines.
So it sounds like it's not just a technological challenge, but also a societal one?
Absolutely. It's a complex web of stakeholders. But it's crucial to get those regulations right to protect patients and the integrity of the healthcare system as a whole.
It's like we're building the plane while we're flying it.
In a way, yes.
Okay. And what about research? Are we doing enough to stay ahead of the curve?
That's another key point. We can't forget about the need for ongoing research and development. AI is constantly evolving, and we need to keep investing in research to push the boundaries of what's possible and ensure that AI in healthcare remains at the forefront of innovation.
So it's not just about implementing the tools we have now. It's about continually innovating and developing even more sophisticated and effective solutions for the future.
Precisely, the future of AI in healthcare is incredibly promising, but it requires ongoing collaboration, innovation, and a commitment to ethical principles.
You've given us so much to think about. From personalized treatment plans to data security and the regulatory landscape. The world of AI in healthcare is clearly complex, but also incredibly fascinating. It's clear that this technology has the potential to revolutionize how we approach health and well-being. But it's also a responsibility we need to approach with careful consideration.
I couldn't agree more. We need to have open and honest conversations about both the possibilities and the challenges, and work together to ensure that AI in healthcare ultimately benefits all of humanity.
Well said. Now, before we wrap up this incredible deep dive, I want to circle back to something you mentioned earlier that really caught my attention. The potential for AI to predict an individual's risk of developing certain diseases. That's both fascinating and a little bit daunting. Can you elaborate on that a bit more? What does that look like in practice? Are we talking about AI algorithms that can analyze our genetics and lifestyle to predict our future health?
That's exactly what we're talking about. AI algorithms can analyze vast amounts of data, including genetic information, medical history, lifestyle factors, and even environmental data, to identify patterns and predict an individual's likelihood of developing specific diseases. This is known as predictive analytics, and it has the potential to completely transform preventative healthcare.
Imagine having that kind of insight into your future health. It would be like having a crystal ball that could tell you what health challenges you might face down the road. It's a lot to process.
It is, and while the potential benefits are undeniable, identifying individuals at high risk allows for early intervention and preventative measures. There are also important considerations to address.
Yeah, absolutely. Like, would you even want to know? It makes you wonder if that knowledge would be empowering or just create anxiety.
It's a complex issue with no easy answers. Some people might find the knowledge empowering, allowing them to take proactive steps to manage their health. Others might find it overwhelming or even paralyzing. It really depends on the individual and their approach to health and risk.
I guess it's like anything else. Some people are more comfortable with the unknown than others.
Exactly.
So it's not just about the technology itself, it's about how we use it and how we prepare individuals to receive and process that kind of information.
Exactly. We need to approach predictive analytics with a focus on empowering individuals, providing them with the resources and support they need to make informed decisions about their health, rather than just giving them a prediction and leaving them to figure it out on their own.
It's like a personalized early warning system for your health.
Right.
But it needs to come with a support system and guidance to make it truly beneficial.
I think that's a great way to put it. And it highlights the importance of the human element in all of this. Even as AI becomes more sophisticated, it's crucial to remember that healthcare is ultimately about people caring for people.
I couldn't agree more. This deep dive has been a whirlwind of information and insights. And I'm feeling both inspired and a little bit overwhelmed by the sheer potential of AI in healthcare. It's clear that we're on the cusp of a healthcare revolution. And it's both exciting and a little daunting to think about what the future holds. So we've talked about a lot of really cool stuff today, AI in healthcare.
Yeah, it's been a really fascinating discussion.
It really has. And it seems like there's so much potential for AI to really revolutionize the way we approach health and well-being. But as with any new technology, there are also some challenges and ethical considerations that we need to be aware of.
Absolutely.
And I think one of the biggest questions that came up for me was the idea of predictive analytics. This idea that AI could one day be able to predict our future health risks. So I want to kind of put that question out to our listeners. If you had access to that kind of information, would you want to know?
That's a tough one. It's like, on one hand, having that kind of foresight could be incredibly empowering. It could allow you to make proactive choices about your lifestyle and your healthcare.
Yeah, you could start making changes today to prevent something from happening down the road.
Exactly.
But on the other hand, some people might find that knowledge really overwhelming or even anxiety-provoking.
Right. It's like, if you're told you have a high risk of developing a certain condition, it could really weigh on your mind.
Yeah, it could totally change your outlook on life.
And it's not just about the individual either. We have to think about the societal implications as well. Like, what if this information was used by insurance companies or employers?
Oh, wow. Yeah, that's a whole other can of worms.
It is. So it's really important that we have these conversations now as this technology is developing, so we can make sure that it's used ethically and responsibly.
I think that's a great point. We need to be thinking about not just the potential benefits of AI, but also the potential risks.
Yeah.
And make sure that we're putting safeguards in place to protect people's privacy and autonomy. Well, this has been an amazing deep dive. I feel like I've learned so much.
Me too.
And I hope our listeners have too. So until next time, thanks for joining us.
Yeah, thanks for having me.